Over time, we learned that many of our members were participating but did not find the program to be of particular value. It took a lot of time. It took a lot of financial resources. It caused a lot of anxiety, and at the end of it, people still weren't really able to answer the question, is this doing anything to make me a better dermatologist?
That's Dr. Eric Stratman, and this is Dermatology Weekly by MD Edge, where we bring you news and developments in dermatology and peer-to-peer conversations with Dr. Vincent DeLeo. I'm MD Edge editor Elizabeth Mishkati.
And I'm MD Edge editor Terry Rudd. Today, dermatologists had concerns about the American Board of Dermatology's Maintenance of Certification program, and the board listened. Dr. Vincent DeLeo speaks with Dr. Stratman about how the board's new web-based assessment platform, CertLink, makes continuing certification activities more accessible and more meaningful to clinical practice.
In the news this week, social media may negatively influence acne treatment, as many patients may be consulting their online community for advice. And later, we'll look into the high cost of epidermolysis bullosa. Plus, the newest Barbie doll lineup includes a doll with vitiligo.
Remember, if you have feedback or suggestions, you can email the show at podcasts@mdedge.com. We always take your thoughts into account as we look to improve the show. And we love ratings and reviews on Apple Podcasts.
And now the news.
Many patients consult social media for advice on acne treatment, and they follow recommendations that don't align with clinical guidelines. That's according to the results of a small survey published in the journal Pediatric Dermatology. The researchers report that just under half of the 130 patients surveyed consulted social media for advice on acne treatment. Of those who consulted social media, more than half followed the recommendations they got online. Recommendations that don't correspond to American Academy of Dermatology guidelines. In the survey, researchers at West Virginia University found that 58% of patients did consult a medical professional for their first acne treatment. However, 16% said they went online first. The most common platforms used were YouTube and Instagram, followed by Pinterest, Facebook, Twitter, Snapchat, and Tumblr. The advice patients reported getting from social media included using over-the-counter products, making dietary changes, using self-made products, and taking supplements. It also included making changes to exercise routines. Perhaps not surprisingly, 40% of patients reported no improvement after following social media advice, and more than 50% reported minimal improvement. The researchers say the results show that dermatologists should ask patients about social media acne treatment advice and address any misinformation directly.
Will the cost of newer, better treatments for epidermolysis bullosa be justified? Dr. Jemima Malario says the answer lies in the steep cost of wound dressings. Dr. Malario is a consultant dermatologist at St. John's Institute of Dermatology at Guy's and St. Thomas NHS Foundation Trust in London, and her latest research puts a price tag on the heavy burden of epidermolysis bullosa, or EB. Speaking at the 2020 EB World Congress in London, Dr. Malario reported results from the prospective epidermolysis bullosa longitudinal evaluation study, also known as PEBBLES. PEBBLES is following the natural history of recessive dystrophic EB. She and her colleagues found that it costs more than $3.7 million every year to dress wounds for the treatment of 50 patients who have recessive dystrophic EB. 71% of study participants changed all of their wound dressings at one time, patching them up when it was required, and 14 of the 49 adults in the study had paid for help in changing their dressings. Given that the average annual cost per patient was around $3,300 for patients with inversa disease and nearly $14,000 for generalized intermediate disease, for generalized severe disease, the tally reached a staggering $130,000. Dr. Malario also presented cost data for patients who experienced itch. Despite experiencing itch, more than half of patients weren't using any kind of treatment. She said that most likely reflects current medication's ineffectiveness at relieving that symptom. You can find more data from this story, including data on itch, pain, and quality of life, by clicking the link in the show notes.
And physicians are delighted about the latest news on Barbie dolls. The new lineup of Mattel's iconic dolls will include a doll who has vitiligo. Mattel says offering a doll with vitiligo allows children to play out more of the stories they see in the world around them. Other dolls making their debut in the Barbie lineup include one with no hair, one with a darker skin tone who uses a gold prosthetic limb, and a Ken doll with long, rooted hair. Dr. Simal Desai is a dermatologist at the University of Texas Southwestern Medical Center in Dallas. He says that for young children and adolescents with vitiligo, kids can be cruel with name-calling and social criticism. Dr. Desai says efforts like the new Barbie celebrate diversity and inclusiveness, and they go far in helping children and young adults embrace their skin and their own identities. He adds that the newest Barbie could help break down barriers and create awareness of vitiligo, and it could potentially even reduce bullying, stigma, and a lack of knowledge about vitiligo among the general public. Remember, you can find links to these stories in the show notes. Dermatology Weekly will be right back after this message. And now it's time for Peer-to-Peer with Dr. Vincent DeLeo and Dr. Eric Stratman.
Today we're talking to Dr. Eric Stratman about the recent continuing certification changes in dermatology. Dr. Stratman is from the Marshfield Clinic Health System in Wisconsin and currently is Vice President of the American Board of Dermatology. Thank you for joining us today, Dr. Stratman.
Thank you, Dr. DeLeo.
So let's get started. How did the American Board of Dermatology arrive at the decision to revise Maintenance of Certification, or MOC?
Maintenance of Certification began in 2006, and over the first 10 years of that program, there was a fair amount of disgruntlement and concern over the value of the first iteration of MOC. Over time, we learned that many of our members were participating but did not find the program to be of particular value. It took a lot of time. It took a lot of financial resources. It caused a lot of anxiety, and at the end of it, people still weren't really able to answer the question, is this doing anything to make me a better dermatologist? The dermatology community voiced their concern, and the American Board of Dermatology was listening. Like other diplomates, the American Board of Dermatology was participating in its own MOC program as well, and we recognized that the program had faults. In 2015, after our first 10 years of experiences, we decided to take a hard look at the program. That hard look involved top-to-bottom assessment of what was going well and what wasn't going so well. The American Board of Dermatology decided to take on some of the education on its own shoulders and create activities that could be made more affordable, more meaningful, less time, and that's where ideas such as CertLink, which is a longitudinal assessment program that is designed to be an alternative to the sit-down, high-stakes examination, came to be.
So now that we're talking about CertLink, can you explain to us what will be part of that CertLink?
CertLink is the online testing platform that's a longitudinal assessment platform that is hosted by the American Board of Medical Specialties, which is the oversight board of the American Board of Dermatology. The American Board of Dermatology board-certified diplomates can log in and take their test over time. They don't have to close their practice, travel to a distant test center, have expensive board review courses to prepare. This is something that they can do right from their practice location or even from home, and eventually even from their smartphone, to take their test one question at a time or up to a quarter's worth of question at a time. The idea behind longitudinal assessment is that this is something that is ongoing throughout your career to stay up to date in your medical practice. The kinds of questions that you're asked assess your medical knowledge, and not just random medical knowledge, but with CertLink you're going to be able to identify a particular type of practice that you practice. So medical dermatology, dermatopathology, surgical dermatology, cosmetic dermatology, pediatric dermatology, all of these are selectable. And it's not all or nothing with each of these. If I'm a dermatologist that practices in central Wisconsin and I see a little bit of pediatrics, I do a little bit of cosmetics and surgery, and I'm principally a medical dermatologist, I have the ability with CertLink to tailor-make the percentages of questions I get from each area so that it best reflects my practice. That's one of the neat things about CertLink, is that it allows the diplomate to tailor the assessment to be more relevant to what they do in practice every day. The diplomate is able to identify the subspecialty mix that highlights what they do in practice. And that's one of the ways that we've tried to tackle the question of relevance so that they're maximizing the kinds of questions that reflect their practice.
This sounds like a great improvement over the previous MOC system. Can you talk a little bit about the timing when people go in to do this? Can they take time off? How does that work?
When a diplomate begins their involvement with CertLink, they are issued a set of 13 questions every quarter, and they can access those 13 questions all at once. They can access one at a time, and it just depends on how they want to take their assessment. Every quarter thereafter, for their active board-certified life, they will receive another set of 13 questions. Now, those questions come in three varieties. There are what we call core questions, which, whether you're a specialist, a subspecialist in dermatology, we are all board certified in general dermatology. And so this is the walking knowledge that one should have in being able to identify dermatology diseases. That's one type of question called the core question. That might be when you see a picture of a patient with psoriasis or molluscum or melanoma, can you identify those diseases on site? Those are the core questions. Concentration questions are the types of subspecialty questions where you will get a multiple choice vignette-based question, and those are in the various subspecialty areas of medical dermatology, pediatric, derm surgery, dermatopathology, or cosmetic dermatology. Those are what you think of as your traditional board-style questions. You get a little story, it asks you a question, and you answer with one best answer. The third and really exciting kind of question is the article-based question. One of the things that we heard over and over from our diplomates is we would like an assessment that helps us stay up to date in the field. What is it that the American Board of Dermatology can do to help us stay up to date in our field? And what we have done is created a series of article-based questions. When you log into CertLink, one of the first things you do is design your assessment for the year. And in that design, you are taken to a library of articles that have been chosen by journal editors and American Board of Dermatology question writers as the most influential articles of recent years, that a dermatologist that sees patients with those kinds of focus areas really should know. That might be a new guideline of care. That might be a new therapy for a common disease, or a new side effect that's being uncovered, things that really can help a person in practice. That library of articles can be perused by each test taker. At the beginning of each year, you select 8 articles that you wish to receive as part of your assessment. When you get to the articles, you read the article, and then when you're ready in that quarter, you launch the questions from that article. Each quarter, you will get 2 articles that you've selected. And what I really like about it is that no one selects the articles for you. The test taker gets to look at dozens and dozens and dozens of articles for the year and picks 8 that are most meaningful to them and their practice. So we find that to be a very exciting aspect of this CertLink. Now, although there are, of course, 4 quarters in every year, we recognize that life happens. And with life happening, the American Board of Dermatology has hardwired into this process 1 quarter off that any diplomate can take each year as a break point. And all they have to do is select that quarter, either before the quarter gets here or at least before that quarter ends. You can designate, I want this to be my quarter off this year. And that allows a little bit of a break from the testing, because this testing is designed to be throughout one's career. It's not just a 1 year and then you're done. It's a continuous assessment program with a few questions here and a few questions there to keep you up to date and to keep your assessments rolling throughout the course of your active career.
What you're describing is very exciting and very meaningful, I think, for diplomats as compared to the old MOC system. Let me ask you a question, Eric. How will CertLink measure performance when the diplomat takes the test?
So it's a difficult question to give an absolute specific answer, but this is how it's going to be at its onset. In order for any test to be graded and an assessment of whether a diplomate has passed or not passed, you have to have a certain finite amount of information, and that finite amount of information, according to our psychometricians, is not going to be available for around 4 years or so. And so for us, we want to get as many diplomates as possible on board with this testing platform so that they can gain experience. And we recognize that in these early years, there's going to be a non-uniform uptake of joining on to CertLink. And so there's basically a 2-year onboarding window that we anticipate. There are people that I meet every day who are board-certified dermatologists that didn't see the email from the American Board of Dermatology, or haven't read the communications, or haven't read the articles that have been written or listened to the podcasts on it. And we understand that. It takes time. And some people just want to not be on that leading edge. They want to see, a little bit of water under the bridge and see how things develop. And we understand that too. I believe that there will come a time about 4 or 5 years into a CertLink experience where a look back will happen, and basically performance will be assessed to say, hey, you're doing great, keep up the good work. And that's what's going to happen for the vast majority of all board-certified diplomates participating. Because one of the exciting things that I haven't mentioned yet is this concept of learning to competence. And CertLink has a learn to competence element to it that I think will be very exciting to diplomates. And that is, when you first see a question in a particular quarter and you answer that question and you happen to get it wrong, first of all, for the concentration questions, which are the board-style questions with the vignette, etc., that has one correct answer, you will get an explanation of why was that right answer right and why were each of the wrong answers wrong. So there's a little opportunity for learning. Now, the American Board of Dermatology does not grade your wrong answer on that first time you see the question. If you miss it, you will actually see a very, very similar question come at you in the following quarter. And if you see that question the following quarter and you've done the learning from the exercise because it gave you why the right answer was right, when you see it the second time around, that's when you're going to get graded. So there's a second chance opportunity to get any missed question correct. And only that second time of seeing it will count for your grade. Now, if you get it wrong the second time, it's going to be counted wrong, and that's going to influence your assessment grade. But I think what we're going to find with this is that, as we would hope, this is a criterion-based grading scheme. So if everybody in the country can jump over the bar, then everybody passes. We don't have a set fail rate. You know, this is something where we are excited to provide this teach to competence kind of testing model where everybody gets a second chance if you've missed the question.
That's amazing. I think the amount of work that the board has put into the development of this CertLink process is just outstanding. And I think certainly the dermatologists who participate will find it a great improvement over the old MOC. So what's the time frame for implementing CertLink fully?
There was a launch that took place on January the 6th of 2020 with a preceding sign-up period that ended in November of 2019. That first grouping had over 4,500 board-certified dermatologists signed up to give it a try. And even in the first week, there were over 800 dermatologists who had participated in logging on and answering some questions. A good chunk of those would take all of their 13 questions for that particular quarter in one sitting. And in that first batch from the first week, there was a correct response rate of over 97%. So we know that there are very intelligent dermatologists practicing very good dermatology in the country. That's our first cohort. Now, in subsequent months, there will be opportunities in these first couple of years. Every 6 months, there will be a window of sign-on time, with the next sign-on period being in May 2020, and that cohort would then begin their CertLink experience in July 2020. So it takes a small window of time to get everyone who's interested, logged into the system, and that takes a little bit of human processing. The next sign-on period is May 2020. And what I tell every board-certified dermatologist that I come across that I'm talking to about CertLink and the American Board of Dermatology is when you see an inbox email from the American Board of Dermatology, it's worth opening and reading. We don't try and sell you product. We aren't spamming you. If there's something from the American Board of Dermatology, it's worth the read. And that's when you're going to see the next American Board of Dermatology email in your inbox is when it's going to say, hey, if you'd like to sign up for the next cohort of CertLink, now is the time to sign up.
This discussion, Eric, has been really amazingly educational for me and certainly for our listeners. I'd like to thank you for joining us today and also compliment you and your fellow board members on the amount of work that this must have taken. And I think it will certainly be an improvement over MOC and something that most dermatologists will find educational, as well as not the kind of onerous process that many of them felt was taking place during the MOC system. So finally, any other words that you'd like to share with our listeners?
I want everybody to know that in the onboarding process, it does not matter where you are in your current cycle. We want as many people to participate as possible. If you're at the very, very end or beyond the end of your cycle and are late for recertification, then you will need to take the standalone exam and then roll into the CertLink process. But if you're in year 1 through 9 of a 10-year cycle, please consider joining. And if you're a lifetime, time unlimited certificate holder of the American Board of Dermatology, it's also a great way to stay up to date and informed. We welcome anyone to participate in this that's a member of the board certified community by the ABD.
Once again, want to thank you, Eric, and refer our listeners to the actual article in Cutis. And I think this has been an incredible discussion of a very important issue. Thanks again.
Well, thank you, Dr. DeLeo.
And that concludes this week's episode of Dermatology Weekly. To get past and future episodes of Dermatology Weekly, subscribe now on Apple Podcasts, Google Podcasts, Spotify, YouTube, or wherever you get your podcasts. I'm Terry Rudd.
For Dr. Vincent DeLeo, MD Edge editor, Melissa Sears, and all of us here at MD Edge, I'm Elizabeth Mishkati. Thanks for listening.